All right, all right. So with that, everybody should now have the ability to record. Again, thank you very much for joining us this afternoon. I'm Brianne Grant with Sarasota County Communications. This afternoon, we are joined by Sarasota Department of Health Public Information Officer Steve Huard and Michael Drennan, Disease Intervention Specialist. And this afternoon, we'll be talking about the COVID-19 vaccines and the distribution to our community here locally. With that, I'm going to turn it over to Steve. Thank you.
Thank you, Brianne. Welcome, everyone. So this afternoon, DOH Sarasota began giving vaccinations to the community. We've started this in an effort to get them out as quickly as we possibly can. We've began with our long-term care facilities that Walgreens and CVS is going through, along with staff and then medical, people in the community. And so now we're at a point where we've been able to open up to 65 and older to the other priority groups. And we've established a process for people to come in and get vaccinations. Again, as I said, we started this afternoon. We're trying to do 50 shots an hour, and we'll do that up until 6 o'clock this evening. And then we'll begin again tomorrow between 8 a.m. and 6 p.m. And I think with that, we can, I'm happy to take questions and go from there.
So Steve, before I turn the floor over for some questions, could you walk us through what the expectation is for people once they've registered for their appointment to receive the vaccine? Will they be driving through to receive the shot? Are they physically walking in? If you could just walk us through a little bit of that process as well, please.
Sure. So we're offering the vaccine here at our main health department location in downtown Sarasota at 2200 Ringling Boulevard. So what people are going to need to do, they'll want to go to our website. There's an area right at the top left corner that has a press release information and then an event information. You go in, you're going to want to print, download and print, and then fill out, sign the vaccine consent form. And then you're going to want to go ahead and click on the make an appointment link, which will take you to an Eventbrite. Basically, it's a ticketing system. And we'll have and do have currently the appointments broken down in 1 hour blocks. So you'll pick your day, and then you'll pick the 1 hour block that you'd like to come to the health department to receive your vaccine. From there, you'll get a ticket that's printed that you can print out so that you have confirmation that you have an appointment. And then when you arrive at the health department, you come into our main entry point, and we've got it very well marked, and we've got people there guiding visitors to the different areas that we're doing vaccines.
Thanks, Steve. I appreciate it. With that, I'm going to turn the floor over for questions. Looks like Tim Berquist, looks like you might have the first question. Turn it over to you.
Okay, so a little confusion. How could it be? Who can get this vaccine, and do you have to be a resident? Do you obviously have to be over 65? What are the criteria? Can you come from another state? What's the deal?
Okay, so you must be 65 or older, and you must be in Sarasota County in 28 days to receive your second vaccine. So if you're a snowbird and you're coming and you want to receive the vaccine, but you're not going to be here in a month to get that second dose, we respectfully ask you wait until you get back to your home. Otherwise, you're going to need to stay here in Sarasota so you can get that second dose here. That's really the only caveat. Again, and then if you're a healthcare worker, you can sign up through the Eventbrite system as well. And all we ask is that you bring your employee identification with you that proves that you are a healthcare worker. Does that questions, Tim?
Yeah, I think so. So there's no resident situation or anything else like that. You just got to be, and you just have to show your driver's license to prove that you.
Yes, sir. Yes, sir. When you arrive, we'd really like if people could have printed out the consent forms, you know, filled them out and signed them. Obviously, if you don't have a printer or don't have access to the consent forms, we'll have them here to fill out when you arrive. Again, that's going to slow the whole process down. So we really are hoping people can, you know, download and print those. Again, you're going to need to have that appointment, the consent form, and then a valid ID.
And then which vaccine is it? Do we know?
Yes, sir. We're doing the Moderna vaccine.
Thanks, Steve. So with that, Tim Fanning, Herald Tribune, you have the next question.
I actually have several questions, but my first one is, how many vaccines has Sarasota County received in the first allotment?
Sarasota County received 3,500 vaccines in the first allotment. We received those yesterday, mid-morning.
Manatee County mentioned that they will be receiving more as they show that they're being used. What is the process here in Sarasota County? Will we be receiving more vaccines as they become available?
Sure, the process is pretty standard across the state, and the supply system is becoming more and more streamlined, shall we say. So as we go through these vaccines, we absolutely expect to receive more in the coming days and weeks.
Great. So shortly after it was announced that this vaccine would be available, it looked like all the appointment slots had been filled. What efforts are being done in the coming weeks to make it more accessible for people to get the vaccine?
Well, as more vaccine becomes available, we are looking at different ways and modalities to get it out into the community. So as we develop more plans, we will absolutely get that information out to the community with the times, locations, and how to get an appointment for them.
And where should we direct people to find more information about the vaccine and their appointments and anything local?
I'm on a press conference, sorry. More information, I think you just asked, right, Tim?
Oh yeah, where should we direct people for more information?
Okay, I would direct people to sarasotahealth.org. And we have an area right there on the front page. When you look at it, that's got a newsroom. So it's basically got all the information right there in the newsroom. You can click there and you can make an appointment, download the consent forms. You can get a lot of information about the vaccination program. Additionally, yeah, we'll keep updating the website and I'll put out another press release when we've nailed down the next set of vaccination.
Okay. My last question involves just process. Can you walk us through what can we expect here in the next several weeks with the county? I know that you guys had just received this vaccine and you're kind of working on getting the distribution set up, but can you give us some idea of what that looks like on the inside? What can we expect here the next few weeks?
I would expect, depending upon vaccine availability, we're going to be doing a lot of more outreach and more clinics and trying to make as much vaccine possible to the community as we can. Yeah.
Thanks, Steve. Thanks, Tim. With that, Scott has a couple of questions. I'll unmute you next. Thank you.
Kind of piggybacking on that a little bit. Do we know how many vaccines? I'm sorry if I missed this part. How many vaccines we have at this point in the county? And then a coworker asked if, and this might not be pertinent to this, but do we know when Englewood Community Hospital will receive vaccines for that part of the Sarasota County?
And Michael can chime in on this. I do not know the total number of vaccines we have in the county. I haven't had a chance to look at the vaccine report from the state yet today. So it's very possible that 3,500 we received, along with whatever SMH and other community hospitals have received, would be in that number, but I unfortunately don't have it. As far as the Inglewood, unless Michael knows different, I don't think we have a line on when the hospitals are getting them, but Michael should maybe pitch in or ring in on that.
No, I don't have, I don't have an update on that. I do know that the distribution to the hospitals is being coordinated through state emergency management, and they probably have a better idea on the scheduling and how it's going out to different hospitals throughout the county and state.
Okay, thank you.
Right.
Right, thank you, Scott. Thanks, Steve. Thanks, Michael. So next up, we have Bob Mudge with the Sun with a couple additional questions. Bob, I'll unmute you next.
Hey, you mentioned that you'll have some forms on site for the people to sign up if they can't get the forms off their computer. How about making an appointment?
We're working on that so that hopefully we'll be able to get some, people will be able to call in and we'll be able to do that, but that's not available at this point. Where obviously this is a situation or an event that is growing quickly. And so we're working to, make sure that we're getting vaccine out as quickly as possible, while we're also, looking at the back end of, the people that we need to be able to, get into appointments manually. So that will be happening, I'm sure, with the next round.
And the 3,500 doses you've got, those are separate from what's been provided to the hospitals and long-term care facilities, right?
Yes, sir.
Do you have any idea when you might be getting more doses? Is that contingent on when these get used up or what?
Actually, I'd probably let Michael answer that, but it's a little bit of both.
I don't think it's contingent on when we use these. Obviously, using these will determine the volume that we get in the future. I don't know the next day. I would assume it would be close to around the same time, Monday or Tuesday of next week, but we don't know that for sure right now.
Thank you, gentlemen.
Yes, sir.
Thanks, Bob. Thank you, Michael. Thank you, Steve. With that, Tim Fanning with the Herald Tribune has another follow-up question. Tim, I'm going to unmute you next.
Steve, I know that you answered this in a kind of roundabout way before, but it seems I just got a couple emails from some readers who are saying that they're getting some conflicting information from the governor's office and from the local health department. So there's snowbirds. Can you kind of address the problem of, like, you don't have to be a Sarasota County resident to receive this. You just have to be in Sarasota County 28 days after you're administered the vaccine?
That's correct, Tim. I don't know any other way to really put it. If you're a part-time resident, we just really need you to be here for that 28 days, so that the way the federal government is distributing the vaccines, they're holding back the second dose. So if we give the second dose, or if we give the first dose, and then the individual travels back to Wisconsin, shall we say, Wisconsin's not going to have their second dose in the pocket, ready. That dose will be coming here to Florida. So it's rather important that people are responsible about the way they're, requesting the vaccine. If you're going to be going home in a couple of days, then it probably makes more sense to go home and receive the vaccine.
The reason, and if I can build on that just a little bit, the reason that's so important is both of the vaccines that are currently available, the Pfizer and the Moderna, require 2 doses, and they have to be of the same type of vaccine. So you couldn't get one Pfizer and one Moderna. So it's very important that you make sure the person gets the matched dose. I'd hate if, to Steve's point, if they get Moderna here and then go back home and Pfizer's what's available, or there's not a dose available because they've allotted doses on the number that they've given out. It's just very important that people get the same dose or same vaccine in that time frame. And that's what's going to that is what makes the vaccine so effective.
Thank you both so much.
Thank you both. I don't have any other questions right now in the chat, but I'd like to give everyone just a couple of more moments just to think about any questions. Steve or Michael, if you have anything to add right now, I'll turn it over to you. I'll give everybody just a moment.
I got one.
Tim, go for it. Thanks.
You talked about the healthcare worker and a certificate. Explain that. What is it? What do they need?
They need to register the same as the 65 and older group. But what we need from them is their employee ID. So we just need them to be able to show us they are a healthcare worker. And that can be done with their medical, with their employee ID. I think, that's what you're looking for?
Okay, and I don't see any other questions coming in. Just a reminder, I did record this session. If you would like a copy of it, please send me an email at news@scgov.net. I'll be happy to send you over a Dropbox link for the full recording, especially for those of you who joined us a little bit later in the session. Another spot for information, in addition to where Steve recommended, we are also adding information to scgov.net. So any information that populates the Department of Health website will also upload to our website as well. And with that, I thank you all for joining us. If you have any questions, feel free to reach out to Steve. He is the lead on this particular topic for you guys. And with that, again, thank you very much for joining us this afternoon. I'm going to end the meeting for all of us.
Thank you.
Thanks, Brian.
Thanks, Steve. Thanks, guys.